Hi, if you're worried about your low back pain and you've tried some exercises, you've gone on the YouTube, you've done some research, you've tried some medication, you've listened to what your friends are doing for helping their low back pain and nothing's getting better, or you're just being diligent and you're looking for more great information on low back pain, I would like to welcome you to our Nose Creek Sport Physical Therapy website where we can help you with that. Um, we have a website that's really designed to help people get some great advice in regards to how they can get their health better. Um, People often will ask me in conversation like, why does back pain last so long and how does it start? And so my goal for today's conversation is we're going to talk about why it starts, why it lasts so long, and how to seek some best advice to really get things rolling and get you feeling better. My name is Blair Schachterley. I've worked as a physiotherapist for over 25 years and built a business here in Calgary over the last 17 years that's dedicated towards helping patients 40 years and older with lower back pain and pain that's persisting that's not getting better. Our goal is to basically get you more active and get you off painkillers. Everyone that comes to our clinic wants to know why the low back pain takes so long. Well, primarily the main reason why it takes so long is the fact that we make a decision early on to not seek help sooner rather than later. So the delay in getting treatment is often why we suffer for so long. The doctors will often say, um, rest, like don't move, don't aggravate your back pain, take some pills to reduce your back pain. They might even say, well, you're getting a bit older, things are wearing out, there's nothing we can do. That's not the truth. The reality is there are solutions for you out there that probably haven't been addressed yet. And later on, if you're still being managed by your family doctor, 5 years later, they'll just sort of give up on you and say, we've done everything we can. There's nothing else we can do medically. Um, but there are modifiable risk factors within your body, and there's physical things that we can change that will reduce your lower back pain. Um, Often, I can see why prospective clients are really skeptical of our service, and because they've received some bad advice in the past that's really, you know, put them through kind of into a chronic low back pain sort of phase in their life. Um, and often exercises, if they're done wrong, or if you have the wrong back condition for those exercises, they can actually exacerbate and make your back pain worse. And then often people will try exercise, get worse, and then stop. And then, then they're not moving, and then they're gaining weight, and they're getting high blood pressure, and just their health is kind of in a downward spiral. So just to give you an example, if you have a really stiff, sort of weak lower back, and someone says, well, you should just go for a half an hour walk, and that'll start to help your back. Well, not necessarily, because sometimes that can overload the tissue, especially if it's deconditioned, and that may exacerbate your lower back pain. Another common thing is people will be told, hey, well, if your back is sore, you need to sit down in a chair and like just rest and take some, pressure off your back. The reality is, if you have sciatica, you're actually putting more pressure on the nerves in your back that's going to make your back worse. So sitting isn't great for someone with sciatica type condition in their back. Or some of my older, more experienced clients may develop what we call a stenosis, which is a narrowing of the intervertebral canal where the nerves come out. And often when they walk, as they're walking and their hips are going back behind them, their legs are going behind them, they're forcing their back into extension. And that's causing some irritation of the nerves in their back and increasing their back pain. Yet when they bend over, they actually get relief. So that gives them relief, and they sort of realize that, oh, bending forward makes me better, and so that type of person, we would actually say, walking's probably bad, but maybe you could sit on a bike in a bent position and cycle and get some exercise that way, and not sort of aggravate your back pain as much. So that's where I think we can give people advice in regards to what types of exercises are good for what types of back conditions. Um, and yes, you can take pills that'll give you some pain relief. You can go to bed and sort of hope the next day that your back pain is better. But that hope strategy, doesn't really guarantee an outcome, and it just, can go on and on forever and ever. So I don't think, the hope strategy is really a great strategy. The next strategy that people often try is they'll start to get into what I call an avoidance strategy. So they'll start to figure out what makes their back worse, and then they'll just stop doing that. But as a result of them stop doing that, they're not as active, and then they start to withdraw from activity and social activities possibly as well, because they'll just tell friends and family, oh, I can't do that, I can't go for that walk, or I can't do that because that's going to aggravate my back pain, so I'd rather not do that. So, and as a result, the person gets less and less active as they get older, and again, they're gaining weight, their blood pressure's going up, and all these other health issues are starting to crop up really fast. So activity is really important to keep us healthy. We need to be able to move to stay healthy. And then, just because your doctor says, we can't do anything else, you're just getting old, just have to live with it. Don't accept that. There are solutions out there for those of you with lower back pain where it hasn't fully resolved, that you probably haven't had what we call modifiable risk factors looked at within a good thorough physical exam of your back and your hips. So even if you can get some relief, like 10, 20, 30, 40, 50%, that can be significant in increasing the quality of your life. Just imagine if you booked an assessment, you came in, you got some relief. Again, just 10, 15, 20, 30, 40, 50%. I mean, wouldn't that be better than nothing? Imagine if you could stop taking your pills and reducing this potential side effects of, things going on internally within your organs from those pills. And not having to worry about a potential surgery on your back down the road. And just simply being able to maintain more independence so that you can lead a more active lifestyle. Heck, simply bending over in the morning to put your socks on or your shoes on and being pain-free. Imagine that. Imagine being able to sort of just bend or reach and twist and not have any sharp back pains. Or physically lift an object, like a box out of the back of your trunk of your car pain-free, and how that would feel. But you can't due to your current pain condition. So whatever your story is, we've likely heard it in our clinic on a daily basis. What we would do is start with you and try to figure out why this has happened, what caused it, provide you with a comprehensive treatment plan that's going to basically address the modifiable risk factors within your back condition, and then return you to work, return you to play, return you to your favorite exercise program, or just lead a slightly more independent life, and not have to depend on people for doing activities, that you might need help with, and being more independent. So if any of this sounds familiar to you and you want to reduce your pain, you want to reduce your pain medication, and you want to stop worrying about your back with simple things like just bending over to tie your shoes, we can help you. So we invite you to join us in a conversation. You can book a telephone conversation with one of our physiotherapists and basically ask your questions, ask the questions that the doctor didn't give you any answers to. The doctors only have 5 minutes with their system to visit with you and talk with you and educate you. We're willing to sit and talk with you on the phone for 15 to 20 minutes and give you the time to help create clarity in regards to how we might be able to help you. And if, after answering all those questions, you feel we're a good fit for you, then you can simply ask to become one of our clients and one of our members in our clinic. Alternatively, if you feel like you're ready to go, you've enjoyed just the website and just kind of listening to me talk a little bit, then you can just simply click on the cost and availability and fill out the forms, and we'll see if we can't get you booked in with an assessment within the next couple of days. And another option we have is for those of you that are very skeptical and had some bad experiences in the past, might be holding back, or just not quite sure yet. Then we have another thing called a discovery session. So you can book a discovery session, you can come in, talk with our physiotherapist face to face, sort of check out our caring environment we have in the clinic, and then really begin your journey there with us, with seeing if we can offer you some advice and some help in regards to reducing your lower back pain. Now, the last thing, and another alternative thing you can do is just simply download the low back pain free report that I have put together. It's a great report that'll give you advice that's for free, that can help you basically with soft tissue pain in your lower back and things to modify at home that would help you on a day-to-day basis. And you'll get what I call a little win. Like, even if you get that 10 to 20% pain relief just from those top 10 reasons or things that you can do, that's going to help you manage your day. So again, the big difference is we have the time for you. And if you feel we're a good fit, again, we have 3 ways you can engage with us. One is the cost and availability sort of inquiry. Number 2 is the telephone conversation. And number 3 is the discovery session, where you can learn a little bit more about how we can help you sort out your lower back pain, or if we can help you. So hopefully we'll get a chance to help you soon and serve you, and the way that you choose to engage with us. So it's totally up to you. Hopefully I'll see you in the clinic, and I would just like to say take care, stay active, and I'm Blair Schachterly on behalf of Nose Creek Sport Physical Therapy, where we get you moving faster and feeling better. Take care. Bye-bye.